The topic I have decided to cover from abnormal psychology is a personality disorder called borderline personality disorder. I have chosen this disorder to discuss due to its personal connection to me. My mom has been diagnosed with borderline personality disorder. Living with another person who has this diagnosis is very difficult and even heartbreaking. Borderline personality disorder is characterized by a pattern of ongoing instability in moods, behavior, self-image, and functioning. A person with BPD can experience intense episodes of anger, depression, and anxiety that may last from only a few hours up to a few days. Let me tell you, in my personal experience dealing with someone with BPD, it is very difficult and has lasted for the past 10 years. Dealing with the throwing things, the smashing and breaking of dishes, to the constant name-calling going on since I was 10 years old, to the continuous fear of abandonment, to the cognitive dissonance, to the repeated threats of suicide. All of these signs are classic signs of BPD, signs that I've had to deal with while living with my mother. A person who has BPD is also very likely to have another disorder inhabiting simultaneously. These can include mood disorders, anxiety disorders, eating disorders, suicidal thinking and behaviors, substance abuse, self-harm, and suicide. Which out of all these, my mom has attempted suicide a few times and has also been diagnosed with extreme depression, as well as suffering from bulimia for quite some time. Many people with BPD report experiencing traumatic life events. In the case of my mother, her mom, my grandma, was a Holocaust survivor. From what I've been told by my parents and from my uncle, my grandma attempted suicide on multiple occasions. The problem with BPD is that it is very difficult to treat, and the only way that a treatment like CBT can be effective is if the patient is willing to go and get the treatment and help they need. In my case, my mom avoided getting the treatment she needed for a very long time. To this day, I'm still not quite sure she got the care and help that she needed. For some people, the symptoms of BPD are so intense that they need inpatient care. For about a month and a half to 2 months, my mom received outpatient care. Borderline personality disorder is a very strenuous disorder on the family and friends of those who suffer from it. There needs to be more research done on this topic so we and the abnormal psychology department can come up with a more effective form of treatment and